Okay, we are live on Instagram though, so that's good. Hi everyone on Instagram. We're trying to get Facebook up and running, but we can start. We'll just get this going when we can.
Okay.
So we are doing microneedling with Jenny, and I'll let you take it away.
All right. Hey, I'm Jenny. I'm one of the nurse injectors here. This is Caitlin, one of our lovely front desk gals. We're going to be doing microneedling with PRP. So before we started filming, Caitlin numbed for at least a good solid 15 minutes to make sure that this is tolerable to get through. We've gotten that all taken off. We've already cleaned and prepped her face, so we're ready to go. We are also doing this today with PRP. So that being said, that is our platelet-rich plasma. We drew blood out of Caitlin's arm, put it through the centrifuge, and actually separated it into our PRP. This is the liquid gold. This is what we're going to be using as our topical agent to help glide the needle over her face. So let's get started, okay?
Excited.
So let's just start from the top, kind of like what is microneedling. So microneedling is a treatment that's been around for a really long time. It was first reported actually being used back as early as 1905, but microneedling kind of as we know it with a handheld device like this has been around since the mid-90s. It's going to be this little tiny handheld pen right here, where we can kind of dial up different depths for how far as we want the needle to go in, and dial up the speed. And what I'm going to be doing is I'm going to be gliding this over her face and creating tiny little micro injuries. Get this guy to go faster.
We got Facebook up and running now.
Hi, Facebook.
So anybody who's just tuning in on Facebook, we are doing microneedling with PRP with our nurse injector, Jenny. And she just gave a little spiel about what it is, but don't worry, she will, I'm sure, say it again by the end of this. So if you have any questions, send them our way.
So this is my little handheld device here, as you can see, or maybe kind of see at the end. There's tiny little needles right up here at the end of the pen. And like I said, I'm going to be gliding these over Caitlin's face gently to create tiny little injuries. The point of this is that as your body is naturally healing itself, it's going to make collagen, it's going to make elastin, it's going to do all these things to heal these little injuries. So it's using your body's own natural healing process. When we stimulate the collagen growth, when we stimulate the elastin growth and all that, it's going to help to treat things like fine lines, wrinkles, acne scars. It can help to kind of break up pigment too, so if you're someone who has melasma, sunspots, things like that. So those are really a lot of the great uses of microneedling. So it can be to treat these things. It can also just be used as a really great way to just, prevent fine lines, prevent wrinkles, things like that.
So we're getting lots of questions. People are asking, does it hurt? Did you numb?
So yeah, I numbed for 15 to 20 minutes, but it's actually very tolerable. It kind of just feels like a vibration against your face. It's not bad at all. It's not painful.
Okay. And then some people are saying, what is PRP and does it really make a difference?
So PRP is platelet-rich plasma. So like I said, it is used, it's part of like I would say kind of like a regenerative medicine. It's using your own blood and getting all the good growth factors, all the good clotting factors, all the good things that your body has to naturally heal itself to reduce inflammation. We're using that as our topical product as we're gliding over her skin. And then it's also, I'm going to keep applying more so it kind of keeps getting soaked back in. Microneedling by itself is a great treatment. Even if you're not using the PRP, it's a great treatment. But it goes from being, I would say, a great treatment to a really, really excellent treatment when you add the PRP.
Someone asked if you offer this on the scalp for hair growth.
We do, yes. So in that instance, we do the same thing, draw your blood, and then we actually come back and we inject it into the scalp. We don't really do it with the microneedling here, we just inject it directly in. Because that can help with stimulating hair growth in areas where people have thinning hair.
Will you see results with one treatment, or do you have to do the a few treatments?
We recommend you do at least a series of 3. One treatment is great, don't get me wrong, but you're going to really see the max results when you stack those treatments on top of each other about 1 month apart. It's like working out one time is great. That's obviously good for you, but you're not really going to reap the benefits of one individual workout. You want to do, them over and over to really get those benefits.
And does it help with melasma?
Yes, it does. It can help to really break up that pigment. So it's great if you're someone who maybe has melasma, you can't do IPL because IPL can sometimes make that melasma worse. This is something that you can do to help really break up that pigment, and then I would definitely recommend coupling it with some of our good topical products, like our Koji pads, any of our other products that contain any brightening agents in it. So this would be great for that.
How far in advance do you draw the blood for the PRP?
Really just when the patient comes in and as they're numbing, we draw it at that point. So about like maybe 10-15 minutes before we use it. So as I'm doing this, I'm also able to dial up how deep I'm going with the needle. So on bonier areas like your forehead, we normally only go down about 0.5 millimeters. Then as we get into thicker areas like your cheeks, we can dial up to 2. It's also just kind of based on how the patient can tolerate it and the response I'm seeing at her skin. I do want to get kind of like that inflammatory response going on. So I want her skin to get a little bit red, to maybe even bleed a little bit. You don't have to be, a bloodbath to get a good result. We just want to see that it's getting red, it's starting to look a little bit inflamed, because that's going to trigger that healing process that your body does on its own.
For sensitive or inflamed skin, would you wait for the skin to calm down before this treatment? What about like inflamed cystic acne?
So I would definitely say I would not want to go over active breakouts or like active cold sores, anything like that. That would just irritate it further, spread bacteria, stuff like that. So if you come in and your whole cheek has like cystic acne, I probably would recommend getting that better under control, because I just would hate to waste your treatment only doing your forehead and nose. If you have like one little zit on your cheek, we can obviously just go around that. I would recommend not using products that are going to be irritating to your skin, like maybe your retinol or strong acid pads, for a couple days beforehand, because I just want your skin to be kind of as healthy and healthy as it can be before we start this treatment that's going to kind of make it a little bit irritated and inflamed. But if you're someone who uses retinol every day and it doesn't irritate your skin anymore, then you don't necessarily have to not use that the night before. It kind of just depends on your skin.
Does this help with scarring?
Yes, it definitely does. So it can definitely be used to treat acne scars, surgical scars, any type of scarring. It can help to kind of break it up, flatten it out, things like that.
And then, do you recommend this procedure before Botox and CO2 laser? I'm assuming they mean like that day?
You can do microneedling and Botox on the same day. We would just want to do your microneedling first, because after you get Botox, we don't want to be putting hard pressure on those areas and possibly pushing the Botox in the muscles we don't intend for it to be on.
Okay.
So if Caitlin wanted to get Botox today, we would just do it after the microneedling treatment. If you're doing a CO2 laser, you definitely would not want to do those on the same day. That would be way too much. You could do both, but we would have to kind of, get a good plan together how we're going to incorporate both these into the best, plan for you.
And then would you suggest this or IPL?
It just kind of depends on what your issues are. If you are wanting to target fine lines, wrinkles, acne scars, I would say this microneedling for sure. If you're wanting to treat sunspots, I would say if you're a candidate, I think IPL probably is better. But again, it just depends. If you are someone who has some melasma too, then you might not be able to do the IPL, and this would then be a better treatment.
Someone asked if there's any discoloration or bruising worries for women of darker skin tones.
I guess the microneedling will make you more at risk of having a deeper...
Right.
No, not really, no. I mean, if you're someone who has a history of hyper or hypopigmenting very easily after procedures, I think we just lost some power somehow. If you're someone who has a risk of getting really bad hyper or hypopigmenting that's not permanent following procedures, then we could still do this, just knowing that you might have a prolonged period of some hyper or hypopigmentation. If you're someone who has permanent scarring from procedures, then I would say I don't want to do this and risk that would happen to you again. But really, this can be used on any skin type, any skin tone, any skin color. So it's really can be used on anybody.
How long will the redness last after treatment?
When you leave today, you're pretty much going to be a tomato face, so plan on that. After that, I would say about 1 to 3 days of redness for most people. If you're someone who has really sensitive skin, you might have a little bit of redness lasting longer. But I always feel like you can get it done, and the next day, I feel totally fine going to the grocery store, running errands, anything like that. So a couple days of redness, and then I feel like for the remainder of the week, just plan on your skin kind of feeling dry, maybe a little bit gritty, but it should really look okay at that point.
What does the aftercare look like? Can you use exfoliants? Can you use chemicals? Can you work out?
So we tell people, we ask people not to work out for 24 hours afterward, and not to go swimming for 24 hours afterward. That's just because we just put all these tiny little holes in your face. We just don't want bacteria or anything to get into those little tiny injuries. So no working out, no pools for 24 hours, no makeup for 24 hours. Later this night, I would tell her to just either use just water to wash her face or maybe a really, really gentle cleanser. The next day, so 24 hours later, you can do SPF, you can do gentle lotions, like hyaluronic acid serum, that would be great. Nothing acidic, like retinol, or glow pads, anything like that. Maybe not even vitamin C for, I would say, at least 3 days, but maybe more like 5 to 7. It kind of just depends on your skin. I just don't want you using anything on your skin that's going to irritate it at baseline before your skin is back to normal. We also really recommend, and if you're not using the PRP during your procedure, we use one of our products that contain growth factors. So like any of the products from like our Neocutis line, like our Neocutis Biogel, Bioserum Firm, anything like that. And that's going to be a way to help try to get in more growth factors. So if you have one of those products at home already, that would be something that would be really, really good to be using, in the days to weeks after getting the microneedling done.
Someone had asked if, how is this different from Morpheus?
So Morpheus is also, it's similar in the fact that they are both microneedling procedures. With the Morpheus, it is also using radio frequency to generate heat. So, see, you guys can see how I'm gliding this over her skin just like this. With Morpheus, it's more of a stamp, like, and when the needles are in the skin in Morpheus, it's releasing a little bit of heat when it's deep down into your skin. And so that's just kind of an even more exaggerated effect to get that injury, to get that collagen stimulation.
Can you do this with filler in your face?
Yes, yep, you definitely can.
Yes, I have filler and
Will microneedling help reduce pitting scars from the plasma pen?
It should help with any type of scarring like that, yes. So yes, it should. I will say though that it's going to help to lessen it. This isn't going to be a way that's going to be able to completely eliminate your scar as if it never happened. It's not going to be able to do that. But our goal here is to lessen, to smooth, to decrease those scars.
Is this helpful for enlarged pores?
Yes. Yes, it is. Doing this and then also incorporating in our glow pads, those are kind of my go-to for large pores.
How long does the total appointment take?
So you come in and then you probably get your blood drawn, numb for 15 minutes, and then I'd say it takes maybe about, maybe only really like 20 minutes to do it, but then we probably end up talking about, pre-care, post-care, products, things like that. So I plan on being here for, maybe 30, 45 minutes or so.
After your initial 3 treatments, how often should you do it for maintenance? That's a great question.
Mm-hmm. So I would say, come in and do your first 3 treatments, right? After that, give it about maybe, I say you could either do this. You could either come in for a maintenance every like 3 to 4 to 6 months and just do another treatment to kind of keep maintaining that. Or if you're someone who wants to just come in yearly and do like your 3 treatments every year, that's also a great option. At either one, you're going to get good results. It's going to kind of help to maintain it. It just depends on what works best for you and your schedule. So I'm going to dial up to some of the deeper stuff now to get those cheeks, okay?
What's the difference between this procedure and the Hydra Needle?
So the Hydra Needle involves cosmetic microneedling, so it does not go as deep as we are able to here with the medical microneedling. That and it just involves other things that the estheticians can do for our facial treatments. This is just the microneedling portion of it.
Awesome. Let's see. We talked about how many sessions you needed. We still recommend glow pads. Is microneedling without PRP on sale? No, the special is microneedling with PRP. We talked about how often it should be done. Caitlin, someone's asking if this is painful.
No, it's actually, with the numbing, it's very, very tolerable. I could almost actually like fall asleep during this. Sometimes on like the bony areas, like the forehead, it's a little bit uncomfortable, but it's really not bad at all.
What about makeup? When can you wear makeup?
So I recommend 24 hours later. Again, we just want to, because we want to make sure all these little tiny holes are closed up. that you're not doing anything that could introduce bacteria. I will say too, it's probably a great time then to be washing all of your makeup brushes. So when you are applying that makeup, it's again not with makeup brushes that have, you know, bacteria and whatnot on them.
What is the difference between this blood when you I can't talk when you're drying this blood or when you're just at a regular doctor's office getting your blood drawn?
So when we draw your blood here, we are putting it through something called a centrifuge. It's a machine that takes the blood and spins it to separate out the red blood cells from the plasma. The plasma is kind of like the liquid portion of your blood that contains the platelets, other properties that are really important for the healing process. So it's the same idea that your arm's going to be poked with a needle. We're going to draw the blood out. But normally at your doctor's office, they're sending it off to the lab as a whole, you know, blood specimen. Well, we're separating them out into to those two different things. So when we pull it out of the centrifuge, you can actually see that it's all the red at the bottom, all the red blood cells, and then all the clear kind of liquid gold serum at the top.
Perfect. Well, that brings us to a close for this live. Hopefully we answered your questions. If we did not, we highly recommend you text us at 314-991-5438. We have many people standing by to answer your questions, help you out, get you set up to order, and take advantage of these once-a-year deals. So thank you everyone for tuning in, and we will be back soon with our next live demo.
Thanks.
Thank you.